This is the most important thing in plastic surgery right now, aftercare. There is a buzz about aftercare. Why? There are all these plastic surgeons doing tons of plastic surgery, especially here in LA. And the truth is that after surgery is just as important as what happens in the operating room. Recovery is key. Very few surgeons have set up protocols to ensure really good, smooth transitions after surgery. Patients should not go straight home after some of these big, massive surgeries. In my office, when I do a tummy tuck or a facelift surgery, all of those patients are going to aftercare the night of, so that a nurse can give them medications for sleep, nausea, and discomfort, and so that I can come see them to make sure that they're safe and they're comfortable. This allows us to catch up to 90% of the types of early complications that happen within the first 24 hours to intervene and improve the quality of their care. What are the things that can happen that we can prevent? Number one, if they're in pain, I can give pain medication. Why is this important? Because if you're in pain, you're not walking, and that can create a DVT or a blood clot in your legs that leads to a problem. Number two, I can help avoid things like hematoma. If I see early swelling, early problems with bleeding, we can intervene and know that we have to do something. Number three, I can look to make sure garments are not tight or compressing areas where the skin is, because the skin is still numb from surgery. It can create something called a faja burn or skin necrosis, where the edges are just rubbed against by the end of the garment, or there's decreased blood flow to the skin causing a problem. There are so many issues that we can intervene in that are medical issues in the first 24 hours. That's why aftercare is king. And my commitment to my patients is to be the best at it. And there was recently an article where they profiled what I do in my practice. So it's not just me telling you this. This is published in the press. People have investigated this and said, hey, Dr. Gould's protocols are amongst the best in the world. Why? Because I care, because I think, what would I want if it was my mom or my sisters having the same surgery done? The most important thing right now in plastic surgery is aftercare. Don't forget it.